Welcome back to Arthritis Now, brought to you by the Arthritis National Research Foundation. I'm your host, Kyle Langen, and today we're going to be talking to Dr. Salvatore Albani, a pediatric rheumatologist and two-time ANRF grant recipient. So sit back and relax as we jump right in. Hi, Dr. Albani. How are you doing today?
Pretty good, thank you.
Great. Thank you so much for being here with us. You're our first international guest, so it's pretty exciting.
I'm excited too.
Okay, good. So you were funded by the Arthritis National Research Foundation twice, once in 1992 and 96, correct?
That's correct.
And where are you from originally?
As you can easily tell from my accent, I'm from Italy.
Italy, great.
I spent the most of my professional career in San Diego, California.
Oh, okay, perfect. Great. And you are in Singapore, right?
Yeah.
Great. And because you have traveled so much, what have you found are some of the differences between doing research abroad versus doing it in the United States?
Particularly my area of research, which is entirely translational and so almost completely focused on humans, there is an increased difficulty in starting and completing a certain plan, a certain program in a comprehensive fashion. The landscape of research is fragmenting in the US and Europe. And the opportunity which Singapore is offering is almost unique, insofar they are thinking very differently, and they see translational research, which is again a bridge which you build between an idea and the patient, and is a two-way bridge. They're building research in this area as something which is comprehensive and coherent, so it should make it easier to accomplish this, in essence.
So if you could give us and all of our viewers a lay summary of what you're currently working on, that would be great.
So I'm a rheumatologist and I'm an immunologist.
Okay.
What I've always been interested is understanding immunology, and particularly the immune process in arthritis, and ideally use this knowledge to manipulate whatever processes are impaired or abnormal as a novel therapeutic approach. So I was able to develop an entirely new drug or therapeutic approach from abstract idea to phase 2. There are several phases of clinical development. So it already has been tried by 96 humans. And is a tolerogen, meaning it's a way to re-educate the immune system in a very physiologic fashion, so respecting it. And I plan to bring this to complete fruition if, of course, its efficacy will be fully demonstrated, and that could be a paradigm shifting. So this is one area, manipulating immunity. The other is addressing questions such as why only a proportion of patients with arthritis, for instance, respond to certain therapies. These therapies are very expensive. They have a lot of side effects, and they work really well in less than half of the patients. So we have developed technology approaches which are innovative. Insofar we get a lot of data, and we look at clusters of this data which are meaningful, that they're functionally meaningful. And then we associate this data with clinical outcomes. So we're not looking for a single thing which by chance or study associates, but we're looking for a certain function which is different and clinically meaningful. So we have discovered, in fact, now that by using this approach, that a certain type of cells is present in patients who will not respond to those therapies, and these are children with arthritis. So there is a predictive and there is a confirmatory value to this, and if you look in a different dimension, you can find also new targets for therapy. So in short, it's understanding immunity and using the knowledge for benefit of patients.
And so you are a pediatric rheumatologist.
Yes.
What was it about that attracted you? Was there kind of a personal connection between you and pediatrics, or?
In this case, it's a combination of definite interest and probably an innate love for children. I found very intriguing and inspiring the possibility of conjugating a very ethereal, esoterical things like immunology with the daily suffering of the patients. It gives motivation and it gives you a reason to do it.
Thanks for watching part 1 of our interview with Dr. Albani. Make sure to subscribe to our YouTube channel and check us out at curearthritis.org for the latest arthritis research updates. We'll see you back here for part 2.